side pocket. You're going to remove the footrest.
That's first. Side pocket, footrest.
You're going to remove a crank handle.
I'll do both. One will count better. I'll do both recordings. One will count better.
Okay.
And then we, with one person holding down the bag, we lift up. And I will say that it's much easier to be on your knees and to lift it out of the bag. Because this is 65 pounds. If you are standing and bending, it's hard on the back. So save your back, and you can use better body mechanics doing it from your knees. And so we're going to take the chair, set it down, and the first thing you do is set it up on its left side, and then right here is a long bar. You pinch this little lever, and you push the bar back. And then you take the bar and you swing it out. Second step is that you get your crank, and the crank was going to go on this side slot. This little black sleeve is going to stay in that slot. And this crank is going to attach to a receptacle past the pin. And you just pull back slightly to make sure it's engaged. Then once it's engaged, then you can start, and it's much easier to unfold the chair while it's on its side initially. Once you've cranked it out, then you set it on its four legs. And then we come over here to the back side of the chair, and we'll lift this bar up. And at the top of the bar or rod is a hole. And then you take the back of the chair, line it up with the two holes here in this slot. And these two holes should line up. You then take the pin and slide the pin through the holes.
Okay.
Okay, and so the adjustment of the chair is simply done, the back is simply done by pinching the tube and lowering it and raising it. The next step is to take the headrest that rests on top of the chair against the Velcro strip in the back. That places and supports the head. Next, and this is the more critical part of the assembly, we take the footrest and we screw out the two knobs there, and then these two bars are going to slide into the rails here. Now you'll notice that there are two concentric rings here. They should go into the reset slots of the chair. And the whole objective, and one of the things that we're finding is that it's not going all the way in. The reason it's not going all the way in is that we haven't cranked the chair high enough.
Oh, interesting.
Okay. So crank the chair up.
Will it stop when it's all the way up or no?
Well, it'll stop.
It'll be a stop.
There's only so far you can crank it. That's good, Bob. Now we're going to take this, and what we want to do is to turn the dial. And what I suggest is turning this in alternatingly. And our objective is to get the larger ring into the slot, but it doesn't have to be torqued on because this bar here is aluminum and the knob is aluminum, both soft metals, and if you torque them, they bind. And you'll have to use some channel locks to loosen it. That's why you see the scrape marks here, because that is what has had to be done. So I will jiggle this a little bit and turn it till it's just in the slot, and I'll do likewise on the other side. That is to prevent this footrest from sliding out. So it doesn't have to be tight.
Really tight, no.
I don't want it tight because the disassembly is going to be much more difficult.
So is this high enough now?
What I'll do is that I will take the chair. Patients seem to, especially our senior patients, seem to enter and exit the chair easier when it's high. So just as a rule for me, I will crank the chair up to my knee height.
A little higher, huh?
So when it's up to about my knee right there, I stop. That's a good height.
So there's no marks on the chair?
No.
Or anything where they go, okay. Sometimes they adjust it.
Just knee high.
Oh, okay.
Once I have the chair assembled, I'm going to lower the back. And then I'm going to align the chair with respect to the delivery unit. And it has casters at the end, and we're just going to come here at an angle and set the chair there. So all the other chairs should follow similar
A
position.
little bit of an angle, yeah.
Okay.
Okay?
Thank you very much.
Awesome.
All right,
Thank you.
thank you.
Thank you.